start. So I can see some people are joining us, which is really good. We're just going to wait slightly longer to make sure that most people have managed to get in before we actually start the meeting. Okay, so I'm going to start the meeting now. I'm hoping that most people have managed to log in by now. This is the annual meeting of Healthwatch Croydon. Ordinarily, we'd be doing this face-to-face, but in these difficult times, we've decided to go online in the hope that more people will be able to join us from the comfort of their own homes. So although we're not able to give you refreshments this year, hopefully you've been able to sort that out for yourselves. This meeting, I hope, will be interesting for you. We are actually recording it live on YouTube, and hopefully that's not a problem for anybody. During the 2-hour session, we have quite a number of things for you all to listen to, and we'll have some opportunities for you to participate as well. So if you just bear with me a minute, what we're actually going to do first is I'm going to run through the broad programme and let people know what's going to happen. Then we're going to have a poll to see how many people are able to participate at the moment, and then we're going to start the meeting proper. So when we get started, I'm going to give a bit of an overview of the year April 2019 to March 2020, which is the year covered by our annual report. If you want to find out more about it after the meeting, then the annual report is available on our website, and so you should be able to find that and download it from there. After I've spoken, then we're going to have members of the Healthwatch team, Yinka, Robin, Jeet, and then Gordon, each speaking about some of the work that we've been doing over the last year. We're then going to see some pre-recorded videos from various people, and that will be introduced by Robin, who can explain who the people are and what they're going to be talking about. And then we're going to have the first question and answer session. So if you want to ask a question of the local leadership board, then if you look at the bottom of your screen, I think it's at the bottom on smartphones as well, but it certainly is on PCs and laptops, you'll see the Q&A function. If you could click onto the Q&A function to leave a question, we'll try to answer it during that question and answer session. If we don't manage to answer it then, we'll do so later on our website so that you can see the answers to whatever it was that you wanted to know about. We only have a short session for Q&A for the local leadership board because we want to leave time for Her Worshipful the Mayor of Croydon, Councillor Maddie, Henderson, who'll then be speaking to us before we go to a break. And we're really fortunate that during the break, as well as a bit of a comfort break for everybody, there'll also be an opportunity for you to participate if you want to, or just to watch some armchair yoga that we've organised for people, just to give you a chance to move around a bit before the second half. When we go into the second half, we're focusing very much on COVID-19 and the impacts that the pandemic has had on Croydon. We're going to have a number of people speaking to us about their own personal experiences of working in different support services, helping people through the pandemic. And then we're going to have another panel where we're going to have senior people from health and the council, and there'll be another opportunity for you then to ask questions. So again, if you want to ask questions of that panel, then if you could go to the Q&A function and type your question in there. Now, to help us to sort out which questions for which panel, it would be really helpful if you're asking a question. Sorry, I've just been told that I was muted. Hopefully you didn't miss all of what I've just said. but I'm just talking about the programme that we have today. The second half, we have some individuals talking about their experiences working around COVID-19 and the pandemic. And then we have a panel of health and social care people, senior managers. If you have any questions for them, then please put them into the Q&A function. And if your question is for the board, then it would be really helpful if you could say so when you type your question in, so that we know which ones to try and address as a board. And if your question isn't marked for the board, then we'll assume it's for the health and social care panel towards the end of the meeting. Now, again, there might not be time to answer all of the questions that people are asking, depending on how many there are. If that is the case, then any questions that haven't been answered, we'll be asking our panelists if they would be willing to give us answers afterwards, so that we can again put those onto our website. And then towards the end of the meeting, we're going to have another couple of polls, opportunities for you to express your opinions of some issues to do with health and social care services. So that's a broad outline of what we're going to be covering in the next couple of hours. To start with, we'd like to just try a poll opener, just to try the function and see that it works for everybody. So what we'd like you to do, if you look at this poll on the screen at the moment, it says, what is your favourite place in Croydon? And the options are Lloyd Park, South Norwood Country Park, Crowhamhurst Woods, Viewpoint Addington and Queen's Garden. If you could click your favourite place, hoping it's one of those, and then click submit at the bottom, then that will go through to the piece of IT, I'm not quite sure what it is, that puts the poll results together, and we'll be able to see them in a moment on the screen to see what everybody has said is their favourite place in Croydon. Do we have the results yet? No, they're just waiting. Oh, there we are. So South Norwood Country Park comes out as the most favourite place of the people who responded, with 38% of the respondents. And then Lloyd Park, followed by Crowhamhurst Woods, Queen's Garden and Viewpoint Addington. And I must say, as a dog walker, then I've been to most of those places, and I would agree that they're all really good places to go to. So that's the kind of poll that we're going to be having towards the end of our session, but on subjects related to health and social care. One of our audience has just responded to say their favourite place is Selsdon Nature Reserve, and I agree, that's also a lovely place, but we couldn't put all of them down. Okay, so if I just give a quick run through of our year, April 2019 to March 2020, seems an awful long time ago now, but at the beginning of that year, the local leadership board had just really become fully established. And so that was our first year of operating, although the Healthwatch team had been working in Croydon for several years prior to that. During the year, we did an awful lot of work. I thought it might be useful, given that you don't necessarily have copies of our annual report in front of you, to just summarise what Healthwatch Croydon is here to do. As it says on the banner behind me, that hopefully some of you can read, we're the independent champion for people using local health and social care services in Croydon. We listen to what people like about services and what could be improved. We share their views with those with the power to make change happen. And people can also speak to us to find information about health and social care services available locally. So our sole purpose really is to help make health and social care better for people. And clearly our focus is on Croydon residents and Croydon services, but we also contribute to Healthwatch England's national work. During the past year, we carried out a number of projects, getting the views of local people and reporting our findings to health and social care leaders to help them to improve local services. And we're particularly pleased about one of the projects that we did, which was working with local BAME communities to explore their access to mental health and wellbeing services. Our findings were instrumental in helping the Croydon BME Forum to design suitable premises at the Whitgift Centre for a wellness centre that opened in February 2020. And I hope some of you had the opportunity to visit that either before the lockdown or since. Also in 2019, we worked with some T-level students from Croydon College who wanted to design, run and analyse a survey looking into young people's experience of mental health and wellbeing services. And then they presented that to a panel of senior managers and clinicians from health and social care in Croydon. And that's been very successful in bringing about positive changes to services that are being commissioned locally for young people with mental health and wellbeing issues. People also told us of their concerns about various changes being proposed to local health and social care services. Hopefully by now you've heard about the locality programme that is being rolled out across the borough, but at that time it was still very new and still very much in the planning stage. So with some funding from Healthwatch England, we helped Croydon Clinical Commissioning Group, as it was at the time, to develop their plans for locality-based primary and community health services and to improve their communication with local people about the changes that were happening or being proposed. However, as we all know, during March 2020, our plans for the coming year were really severely disrupted by the approaching pandemic, the COVID-19 pandemic. And so we had to quickly change our approach. Our Croydon office closed, all our staff started working from home and actually still are working from home. And as you can see, we moved to working online. That in itself brings its own challenges, not least that we're all reliant on the stability of our own internet connection to be able to participate in forums such as this. But I hope that people are able to stay with us this afternoon and keeping our fingers crossed that the platforms stay stable and that we get through okay. At the time when we first started working from home, we didn't know what impact the pandemic was going to have nationally and in Croydon. But clearly, as time's gone on, it's become more serious, and what we've been doing has been working closely with health and social care partners to try and see what we can do to get people's feedback and insight onto how the pandemic is affecting them in order to feed that through to health and social care so that they can improve the services that they're offering to people. In a moment, we're going to hear from Yinka, Robin and Jeet about other projects that we did during 2019-20, and then we're going to hear from Gordon about our initial findings following our first survey of local residents about their experience of COVID, and that information was fed through to health and social care managers and clinicians so that they could improve their communication with people. If you could please don't forget to post your questions onto the Q&A function. I can see that we've already got one, so please do keep going and post more questions. And I'm now going to hand over to Yinka, who's going to speak to us about one of the projects that took place in 2019-20. Thank you, Yinka.
Thank you very much, Edwina, for that opening speech. And thank you all for joining us this afternoon. My name is Yinka. I'm the engagement lead for Healthwatch Croydon. Before I highlight on the findings and recommendations and impacts on the street homeless, I would like to talk briefly about the background of this project. So sometime in 2018, on the street homeless, we carried out a project. And based on the findings, we came to realize that 47% of this group did not have a very good experience using the GP service. Nearly 19% had not even registered with a GP. So as a result of this, we decided to carry out a project on people who were living on the street and who did not even have access to health services. We spoke to 50 people between April and December 2019. 34 of them were female and 16 were male. So Healthwatch Croydon conducted a face-to-face interview with the street homeless people at services like the Crisis, the Salvation Army, Rebel Health Services, and Croydon Night Watch. So this was just to give us an indication of what people were actually facing at the time. So what did we find out? We found out that 30% of those who we spoke to actually had lived on the streets between 2 to 5 years. 24% of these people had either a physical or mental disability. Most people actually found the homeless services had actually impacted on their health being. We also found out that some homeless people were homeless because they had immigration problems. One of the themes that actually came up as well was unemployment, relationship breakdown, and so on and so forth. Another thing that came up again was that the street homeless people found it really easy to access these services. So based on our findings, Healthwatch Croydon actually recommended that these services should encourage training and support to enable the street homeless to gain employment. We also recommended that they should also maintain permanent accommodation for options for the street homeless people. Another recommendation that came up from Healthwatch Croydon was that services should provide dedicated therapies and rehabilitation to this set of people, and also to provide support with those awaiting immigration status. I would like to conclude this snapshot by saying the impact for homeless is that it's not on people's agenda to be discussed as a task. And although the COVID-19 has delayed this to happen, it's been an unexpected 2020, but there is also future discussions for this moving forward. If you would like to read the full report of this survey, of this report, you would find that on the Healthwatch Croydon website. We've got a variety of reports on the website. I would just like to say thank you for listening, and I'll pass you on to Robin, who will discuss the integrated care network. Thank you very much for listening. Over to you, Robin.
Thanks, Yinka. So we supported the long-term NHS plan and reported on a new model of care, the ICN Plus. So what is the ICN? For those of you who don't know, the ICN, or Integrated Care Network, is a new model of care developed in Croydon, where GP, hospital, community and voluntary services are working together to deliver care. The project was further to a piece of work we presented at the Health and Wellbeing Board in June 2019. It was accepted that more needed to be done in understanding the resident and patient response to this model, particularly in communication and engagement. This led to a more focused piece of work funded by the Clinical Commissioning Group, or CCG, that we undertook in January 2020 on hard-to-reach groups in Thornton Heath. We listened to residents and gained their views of the new Thornton Heath ICN. We visited the food bank, job centre, adult education and sickle cell centres in the Thornton Heath area. We spoke to 52 residents that would typically be using the services that we were asking about. We saw what the proposals looked like from the patient view. We listened and reported on the perceived benefits and concerns that residents had, and we made recommendations to this end. We learned that most liked the idea that services would be based locally and saw it as more convenient and community-centred, that residents would welcome more education on the ICN. There were concerns that current staffing and the transition to the new model might impact current services. Based on what residents told us, Healthwatch Croydon recommended a threefold strategy: an information strategy. Residents told us they'd like accessible information about the range of services and how they'd be delivered. An education strategy. Residents would like to know how they could proactively improve and maintain their health, and a communication strategy focusing on those engaged and explaining the impact of changes, positives and negatives, to manage their expectations. This independent insight has been heard and utilised by the One Croydon Partnership of Croydon Health Services, the South West London Clinical Commissioning Group, the Croydon GP Collaborative, Croydon Council, South London and Maudsley NHS Foundation Trust, and Croydon's Age UK to help develop the integrated care network model, not just in Thornton Heath, but across the other 5 localities in Croydon. Healthwatch Croydon is continuing to play an active part in the strategy groups and discussion, contributing on patient involvement and influencing change. More information about this can be found on pages 21 to 23 of our annual report, Guided by You, which you can view on the Healthwatch Croydon website, as well as the full reports. I'll hand over now to Jeet. Thank you.
Hi everyone, thank you Robin. Hi, my name's G, I'm the communications lead here at Healthwatch Croydon, and I'm going to talk you through a project that we did in the A&E department looking at service user experience. It was published in July 2020 and we attended the department between August and November. In total we received 79 responses. From the people we spoke to, over 79% of respondents said that the department was good or excellent. People thought that waiting times could have been communicated more effectively. And also, interestingly, waiting time expectations vary depending on the age group. And respondents felt that facilities needed improvement with better seating, water and food on facilities. People felt as though there was an inconsistent approach from staff and processes, and people felt that being assessed more than one person and speaking to more than one member of staff was actually not of concern, and actually was a good thing. So we compiled this information into a report and we put together a range of recommendations. Amongst these recommendations were that we recommended better communication and waiting times within the department, and better communication on processes and customer journey throughout a person's visit within A&E, improved consistency and improved consistency provided from staff within the department, and we could potentially have training around this. So the impact of our report, since the work had been completed, there have been changes within department to improve services within the A&E department. So now there's more comfortable seating provided for visitors. There's improved signage within the department for visitors, so people are able to see how long they're expected to wait within the A&E department. Facilities have also been improved for visitors to make their visit a lot more comfortable. And this all is really great news, and it's really positive for Croydon communities, and just goes to show what kind of impact that we have in line with partnership working with the Trust. Again, the full report is available to read on our website. Thank you.
Okay, hello. Good to be here. I'm Gordon Kay. I am the manager of Healthwatch Croydon, and I'm going to talk to you about the experience of COVID. So suddenly, out of the blue, we had COVID to deal with, and that was quite a challenge because we didn't know exactly what to expect. We, of course, had to, as Marina said, had to decamp, had to suddenly decide what we were going to do. And this meant that we had to think very carefully about how we could approach. Glad to say that we very quickly realized that a survey was required. We did hear through our network that already residents were affected, and within a week of the lockdown beginning, had got a survey out. This worked really well because it meant that we could give a very early indication of how Croydon residents were feeling. And indeed, the survey ran right through the arc of the time that Croydon was affected. Really, our survey completed effectively by the end of May, which was by that time the effect that COVID had had in numbers of cases, in numbers of people affected. That was the big time that we really captured that moment. What we found was that there was still confusion on information, that most people used the national sources. They didn't use necessarily local sources so much, but later on they did. And they felt they needed tailored information, and there was still a little bit of confusion, primarily on if they think they had symptoms, what they had to do, and where they needed to go. Some people had multiple concerns affected by lockdown, their physical health, their mental health. Mental health came out as the most significant issue, and it's not completely surprising. The effect of lockdown, the fear of work, social isolation, the impact of death, hearing that loved ones had passed away but not be able to attend funerals, not being able to grieve in the way that they would. All these things compounded. Concern about basic necessities such as food supply. And of course, for those that needed to access health and social care, real concerns about that. There are of course financial issues, and still concerns around social distancing and prevention, and some people keeping to the rules and others not, and how that was affecting people. There were some positives. Residents did come out and say that they allowed them to enjoy nature more, and they were being thankful for what they had, and to take life a bit more slowly, and indeed, in some cases, eat more healthily. We also found that there was positive feedback to services used, and organisations such as Croydon Council, Age UK, Croydon Voluntary Action, and community organisations such as the New Addington Residents Association, Family Centre and Salvation Army had positively affected people, but exit stations still need to be managed. We made the following recommendations: that more information was needed on testing and prevention to make it clear, particularly how different services work together, for example, NHS 111, and where people could get the information when they needed it, so they could have they could get tested and most effectively. More information was also needed on social isolated people, and how they could be supported in services. It's clear that there was a great service out there, and we're going to hear more about this later on, but it didn't get to everyone, and maybe there needed to be an understanding of why it was getting to some and not to others. Without doubt, the most significant issue was mental health, and it is the longest and most, I think, challenging factor that, as a community, both health and social care and across the community, we've got to deal with. There are people who never had mental health problems, who, as a result of lockdown and the uncertainty over employment and all these things that I've listed, now have mental health issues, and they never had them before. And so we have to think about the design and accessibility of services which have been set up for people who might have accumulated mental health issues over a number of years now, and maybe identified as having mental health issues. There are people now who have mental health issues who 6 months never had it, and services need to respond to that. More information is still needed on contact. We feel that comes out of contacting about services, about service recovery. There's a lot of confusion there, and obviously social distancing promotion and local promotion, which I know a lot of work is now being prepared on this. If we end up having to be in a more serious situation than we are now, that is developing, but that was also one of our recommendations. So we have responded, and so we've also been involved in working with our partners on a shielding project, which has just completed the analysis we're writing up now, and we are still running a survey on care homes. So if you have or know of someone who's in a Croydon care home, you can still fill in the survey as a resident, obviously, as a care home resident, or if you know someone who's a care home resident, or as a friend and family, or as a staff member, with anonymity. You can find the link on our website, because we want to know that the full picture of how people are being affected in care homes. So we've responded, we look to respond and work well. The real output that's come from all of this is that we are really working very closely with all partners many opportunities have come to work, and so we can support in providing the right insight, help decision makers make decisions in view of Croydon residents. And I thank all those who've got involved and taken our insight, not just this work, but our other work, seriously, and have responded well, and looked to find solutions. So thank you very much. We look forward to doing more in the coming year, no matter whatever challenges that we have. And I thank you for this. We're now moving on to some videos. And to illustrate that first, we're going to start with a video of a patient experience, because patients are the centre of what we're all about, hearing their views. And we have a patient experience story about COVID that we're now going to share with you.
So I'm Robin from Healthwatch Croydon.
Hi, I'm Jade, a Croydon resident.
So Jade is going to tell us her story of what happened when she had COVID symptoms and testing. So would you just go through that for us? So when did you first get symptoms? Who did you turn to?
So I first got symptoms on the Wednesday. So I called my GP and they signposted me to the government website. And actually it took me all day to get through and to find a site, you know, the nearest site available. It kept sort of throwing me out. We had to keep trying from, I'd say we got on there about 9 o'clock in the morning, and it took us up to about 5 o'clock in the evening to obtain testing.
And then what happened? So you obtained testing, and what happened from there?
So they booked us in a slot. They send you a text message on your phone. Obviously you had to select the testing site. So the testing site, the nearest one to me was Bexhill-on-Sea, which would have been a 2-hour journey there and back. So I had to ask someone if they could give me a lift because I'm not a driver. Otherwise I wouldn't have been able to have got to Bexhill-on-Sea. That wouldn't have been an option for me.
So you had the symptoms on the Wednesday, and then was it 9 o'clock that night that you managed to get the appointment?
So we had the, so 5 o'clock we managed to get on the site and the slots came up, and the appointment wasn't until 1:30 the next day, 1:30 in the afternoon.
So you travelled down to the testing centre. What was that like?
It wasn't typically busy. It was quite frustrating because they give you the kit. You know, I mean, they described quite well what we needed to do. However, once you've done the testing, you have to register online yourself and you have to sift through all of the documents that they've got on the government website to find the correct part where you would need to get them to send your details via text message or email. It wasn't just like, you know, you just go on the website and you click site testing. You have to sift through a whole lot of documents. So what I'm finding is they're not updating the government website so people can access what they need to access.
Really, you feel that could have been simpler?
Yeah, because I was feeling a little bit poorly. You know, even though I'm fortunate that my test has now come back negative, you know, I wasn't feeling typically very well. So, you know, for elderly people or people, you know, in marginalised groups with disabilities and stuff, that could be quite difficult for them.
Or for people who are not online, not computer literate.
Yeah, so not everyone is computer literate. You know, not everyone, you know, finds it easy to access online.
Right. What did you have to submit to them? So they gave you the testing kit. You did, was it a swab?
So yeah, the testing kit, it's a swab. So it's one swab. So you'd have to put it up your nose, either side of the nostril, and to the back of the throat. You'd have to, like, you know, literally gag on this swab to get enough saliva on it, and then you put it in some liquid and you send it off. They give you all the packages that you sort of like put it in. You have to sort of double it up in a plastic covering and then put it in another plastic covering, and they have like these boxes, bins in car parks. Well, the testing site I went to was a car park, and they had like a bin where you just put it in. But actually, you know, to actually get on the website, like I said, it was quite difficult.
Okay, we are then going to move on to a second video, and I'm going to ask Robin to introduce those.
Thanks, Gordon, and thank you, Jade, for sharing your experience there. Good bit of insight, what to expect if you do have to go for COVID testing. So on to our T-level student work. So it gives me enormous pleasure to introduce Emmanuel, Miriam and Saida, who worked with us on conducting a research report on COVID and mental health. So the students.
Good morning, Emmanuel. Good morning, Robin. Good to see you again. My name is Yinka. I'm the engagement lead for Healthwatch Croydon, and we've got Robin here today, and obviously Emmanuel. So Emmanuel, today is your last day with us, but before you finally exit, I would like to ask you 6 questions, you know, from why you chose Healthwatch Croydon to do your project up until how we can improve. So are you ready to go, Emmanuel?
Yeah, I'm ready.
Great. So the first question I'm going to ask you, Emmanuel, is I would like to ask you, why did you choose to work with Healthwatch Croydon?
Yeah, thank you for the question. And before I start, as you've been mentioning my name, I'm Emmanuel from Croydon College. And the reason why I chose Healthwatch Croydon is the fact that I needed a health-related organization to work with. Yeah, Healthwatch, as the name suggests, is a health-related organization. And also, secondly, I chose to work with Healthwatch because of the course I want to also take at uni, which is pharmacy. It is having an aspect of research in it. And when Healthwatch was introduced to us in school, they made mention of research. So that's also a reason why I chose to work with Healthwatch Croydon.
Why did you choose then, like as a group, I know that you chose your own topic and you chose COVID and mental health. Can you tell us a bit about why you chose that?
Yeah, so when we were beginning our placement was when sort of COVID-19 really came and the cases of it started spiking, and that's when lockdown sort of came into play. So because it was so apparent and we were just going into lockdown, we thought it would be a good idea to choose that to research on, because everything was happening at the time and it was so apparent. So we wanted to see how people were managing and coping with the virus and all the government regulations and how it was affecting them.
What do you think was the biggest challenge of the project for you? What was the biggest challenge?
I think the biggest challenge was working on Zoom. The fact that all of us, literally all of us, all three of us had internet issues at times, so we couldn't come on for some of the meetings, and then we would have to relay the information that everyone would get confused. So is being on Zoom, like if it was face to face like it normally should be, we could have done a lot of work in a short amount of time, and we didn't have to go back and forth on Zoom, because obviously Zoom is also like there's a time limit for Zoom, how long you could be in a meeting for. There's also the fact that if we wanted to ask any questions to our mentors, if we were confused about any work, we would have to email them, and if we had to email them, then we'd have to wait for their reply. Would it be an instant reply, because they were also busy themselves? So obviously if we were face to face, then we could get instant replies. We could work at a faster rate because we had those instant replies. We got the help quickly.
Fantastic. So what did you gain from the project professionally?
So I've gained quite a lot of skills doing this because we have worked on quite a few different platforms. So like doing stuff on Word, having to email stakeholders. We did quite a lot of stuff. I started to learn how to use Smart Survey, which I'd never done before. So that was quite interesting to start using. And we also did a lot of things with analysis of people's responses of questions, things like that.
And did you gain anything on a personal level, would you say?
It was interesting looking into how many different people were affected by different mental illnesses. So that was quite insightful. And also how to sort of look at things with such an unbiased approach and being able to sort of empathise with people. So, yeah.
So now I'm going to introduce a view from a volunteer, from Michael Hembest, who works so hard for us. Michael Hembest.
Good afternoon. I'm Robin. I'm the volunteer and partnership lead at Healthwatch Croydon.
And I'm Michael Hembest, and I've been a volunteer with Healthwatch for some 6 years.
Could you tell us, Michael, how you got involved with Healthwatch Croydon?
I was a long-term reader of Private Eye, and in the last pages there's a thing called In the Back, and in there were the most ghastly stories of treatment in care homes and in hospitals. Many people had sacrificed their careers to become whistleblowers at a horrendous cost to themselves. And at that time, I received an invite to go to the public consultation with the Croydon Clinical Commissioning Group. Historically, it was about over attendance at Croydon A&E. Now there's a familiar thing, and it hasn't gone away now until COVID has sorted it out, which is very, very unfortunate, but it is the truth. Anyway, I met the chairman of Croydon Healthwatch there, and I picked it up and I thought, this is just the thing to do to try and help solve all these problems. And do you know, Croydon Hospital now, Croydon University Hospital, has gone beyond immeasurable, beyond our dreams. And as I walk down the road and I talk to our local people, I never hear a bad word said now. So things are pretty good. Thank you very much there, Robin.
So would you tell us about, you know, A&E is one of them. Would you tell us about some of the recent projects you've done for Healthwatch Croydon?
Healthwatch Croydon I have done interviewing in A&E to try and get why people turn up at A&E, and I've done signage. We walked all around the hospital looking at the signs and also timing the from point to point in the hospital to see what it was, and looking at the routes that people would have to take. I've done helping with the T levels at the college, and just recently we've been looking at the new website that have been introduced by GPs. Now this has been very interesting because they're all individually written by contractors to the GPs, and I feel that some confusion could come in there, because as you go from GP to GP, you're not going to get the same offering, at least on the front anyway. What else I've done? Just recently, I've realised that a lot of people are just not attending hospital, or they're having difficulty getting to their dentist. I tried my own local dentist and she said, try next month. We'll see what we can do then. But fortunately, all my chockers are all in place, so I'm all right. But I'm sure if I had an aching one, I'm sure it wouldn't be such a funny story. But yes, that's what I've been up to.
So you have also leafleted.
Oh yes, that's what I have done. I went round my estate and I met one or two people, and one lady said to me, I've got plenty to complain of. So I said to her, well, here it is. Let these people know.
So thanks, Michael, for all the work that you've done over the last 6 years. Certainly since I've worked at Healthwatch Croydon, you've been such a valuable member of the team. I know that you wear different hats, but while you wear your Healthwatch hat, you're a really active and valuable member of the team. So thanks for coming and talking to us today, and long may we continue.
And long may we at NHS continue, because I was born in 1948 and maybe it'll last until as old as I am. I do hope so, because it saved my life twice now. Once at CUH when I had a sepsis, and I tell you what, that was no fun. But they put the bottles of penicillin, liquid penicillin down me, and I walked out within 4 hours. And that's pretty lucky with sepsis, I'm told. So thank you very much. Bye-bye.
Bit of patient experience there as well.
Yes.
Thanks, Michael. Bye.
Bye.
Hello, everybody. So I hope you enjoyed those videos. They really show what our volunteers do at Healthwatch. We're now going to have a session with the board members. I'm hoping they're going to join me on the screen. We just bear with me a moment. So there's Gordon, who you've already met. Martin Fairs, who's our deputy chair.
Good afternoon.
Thank you. Just looking to see if there's anybody else. And here we have Anantha Ramaswamy, who's another board member, Pat Knight, another board member, and Emma Leatherbarrow, who has a slightly different role. Emma, would you mind just explaining to people what your role is with the board, please?
So I'm from the organisation that provides Healthwatch in Croydon, which is a charity called Help and Care, and we provides Healthwatch in 8 communities across South Central England.
Okay, thank you very much. Now, what we were intending to do at this stage is to have a question and answer session. However, we only have a few minutes, unfortunately, which is really sad, because it would be lovely to hear more from the other board members. we do have a question that one of our attendees has asked about, let me just bear with me while I read it out, what Healthwatch Croydon thinks of the government handling of the coronavirus pandemic. I wonder if anybody feels able to answer that. Perhaps Gordon, would you be able to have a go at answering that question, please?
Yes, we are independent of everyone involved. That is what is in the Health and Social Care Act, of which we're established. What we are here is to hear the views of Croydon residents, and that informs our thinking and our reports and our recommendations. Therefore, we really hold no political position and we're not in a position to sort of critique handling. All we can say is, we've heard this. So, for example, we have heard there's a big issue with mental health, and that mental health services need to perhaps be recommissioned for a new cohort of people. We know, we're hearing questions about dentistry, which is another area where we may well do some work and find out some more information. But that is what we do. We present all our recommendations and therefore a critique of what is being delivered purely from residents' views. We hold no particular view ourselves. It has only the views of Croydon residents.
Okay, thank you very much. Would anybody else like to add anything to that? Just looking to see if people are putting their hands up at all. No, I can't see any hands up from the panel. Perhaps I could just take this opportunity to say that we also, during the year that this annual meeting is covering, which is 2019 to 20, we also had two other board members who've since unfortunately left us, Brian Matthews and Tariq Salim. And so we're currently in the process of recruiting additional board members. And in fact, the interviews are later on this week. So hopefully we'll have some good news for people soon. I'm just going to check, see if there's another question. Councillor Yvette Hopley has made a comment, I think, rather than asking a question, about how important looking into care homes is, given that residents are dealing with social isolation and fear of infection at this difficult time. And of course, we do share our reports widely once they're published, so we will make sure that Councillor Hopley has an opportunity to see the report. Let's see if we've got any other questions for the panel. What opportunities have come out of COVID for Healthwatch Croydon? Is it all bad news? That's an interesting question, isn't it? Would anybody like to have a go at answering that? I'm just looking to see if there's anybody else who would like to say something. Emma would like to mention something. Emma?
I think it's difficult to say there's an opportunity come out of this. I think one of the things that in common across and probably shared with our colleagues in health and social care in Croydon is the degree of joint working has been really good. There was a solid platform, but I think that's been really helpful, and that's helped us too. I think one of the things that we've learned is how to reach out to people in a range of different ways. Now, digital is not the only answer, and for some people it isn't the answer, and we are concerned that long-term reliance on only digital communication will entrench health inequalities, and for some groups it creates a huge barrier to access. But it also enabled us to speak to people in new and different ways, and I think if there's anything good that's come out of it is our very rapid acceleration of our digital skills as a health watch.
That's true, although some of us are more adept with digital than others at the moment, but we're all learning, aren't we? Thank you, thanks. Although we have some other questions, I'm afraid we need to leave it there. As I say, it was a very short period, but just an opportunity for you to see the board and know that they're all working away in the background, attending meetings, representing local residents' views, and working with the staff team on developing new proposals, and of course setting our strategic priorities for the coming year. We are fortunate today in having the presence of Her Worshipful the Mayor of Croydon, Councillor Maddie Henderson, I'm hoping that she's going to be able to say a few words in a moment. I'm just looking to see if there's anybody who can tell me whether that is ready to happen.
I'm here.
Oh, lovely. Thank you very much. Thank you. Welcome, and thank you very much for listening to us over the last hour. Over to you. I know you have to leave at 2, don't you? So I'll leave you to speak now. Thank you very much. Thank you.
Thank you very much. Firstly, apologies for the fact that I had to leave in and very shortly. I've got back-to-back engagements today. It's amazing how many more engagements you can fit in if they're all on Zoom. But starting with, thank you very much for letting me speak to you guys today. I've been aware of the amazing work that Healthwatch do for quite a long time. I first became aware of them actually just purely as a notebook resident on the work you were doing about perinatal mental health. I brought my, at that point, newborn son Liam to a baby and toddler group and just bumped into Jeet, and we got talking, and she was showing me the survey she was doing, and I invited her to come along to a event that I was organising and present the survey there, because it's a subject that's quite close to my heart. With my elder son, I had quite nasty prenatal depression. I was quite lucky, I didn't need extra support, but I'm kind of having it there and speaking to the midwives and the family it really had a lasting impact on how I saw everything about the health service, everything about how my own mind worked, about accessing services. It was quite a defining moment for me, having suffered with that. And it's influenced everything that I've done as a councillor, in particular everything I'm doing this year as mayor, because my focus for this year is about early life. So everything about pregnancy, becoming a parent, whether it's for adoption and pregnancy, or all the way through to the end of the primary school years and everything in between. Because it left me with an understanding that there's never a time in your life when you're more vulnerable, but where you've got a more important job than when you're looking after children at that stage. So I was really, really thrilled to hear that had been a focus of your work. And I've been watching everything Healthwatch do very closely ever since. I'd also like to talk about those amazing students that you work with. That was an incredible interview. I found myself absolutely riveted to everything they had to say. Croydon's really lucky to be the youngest borough demographically in the whole of London. And some of the talent that we see now of young people is absolutely extraordinary. It's amazing to hear the incredible work they've been doing. The last thing I wanted to talk about was the video you did from the patient perspective about getting a COVID test, because that rang so very, very true for me. A few weeks ago, my husband had COVID symptoms, mercifully like the patient that was interviewed. He's came back negative, but he was really, really unwell and he can't drive either. So we're reliant on me, who'd been looking after him round the clock with our two very young children at the same time, driving him all the way to Hackney Marshes. After, again, about a similar length of time, about a day of trying to search for a test. So it was very interesting to hear that exact story played back. That was probably the longest drive I think I've ever done, or at least that's what it felt like at the time. So hopefully that sort of story might be able to add to some of your research as well. Thank you all very much. And I want to finish again by praising the incredible work that Healthwatch do. I really genuinely am impressed by some of the things and the work you've done. And it's excellent to be able to hear some of these real life stories about what the last few months have been like. Thank you all very, very much.
Okay, thank you very much. That's been really, really helpful. Thank you. And I hope you enjoy the rest of the afternoon on Zoom.
It does feel like it. I mean, good luck. I mean it. I'm genuinely meant every word I said then. I think you guys are fantastic. And Jeet and I have kept in regular contact ever since that day we met. So it was really nice when the invite came in.
Lovely. Thank you very much. Thank you. Thanks and goodbye. Thank you. Thanks.
And sorry again, I can't stay.
Okay, lovely.
Good rest of the day, everybody.
Thanks.
Cheers. Bye.
Bye. So I'm going to hand over to Robin now for the next section.
Thanks, Edwina. Oh, I'd like to invite you all to take a break with us now with Karen Bateman. Karen's done some work in social prescribing and she teaches yoga in our community. She's going to teach us a technique called Coherent Breathing. If you want to know some more about the work that Karen does, contact a member of the team, contact Healthwatch Croydon, and we can put you in touch. But let's hear from Karen.
So I'd like to share with you today, now in your break from your meeting, a short breathing practice. It's known as Coherent Breathing, and essentially it's just breathing equally on the inhale and the exhale, and doing this for an optimum length of time, which is really good, has loads of health benefits. So let's make a little start. Let's have a little go with it. So just, if you're sitting in a chair and you've got your legs crossed, see if you can uncross your legs and just place your feet nice and flat on the floor. And I'll just talk us through this as we go through. So place your feet nice and flat on the floor. You can sit up nice and tall, just so that you lift up through the spine, lift up through the crown of the head. Sitting up nice and tall, feet nice and flat on the ground. So maybe place 1 or 2 hands onto your belly. Let's just take a few breaths in and out just to begin with, just to bring ourselves into the zone. So breathe, take a nice deep breath in. Maybe a big sigh out through the mouth. Doing that 2 more times. Just on this last one, notice how you fill the lungs as you breathe in. Maybe the belly expands a little around the middle. And as you exhale, really squeeze out all the breath, so squeezing in around the belly. Notice how it goes, belly falls in. And then just let the breath come back to normal. Drop the shoulders down away from your ears. Stay with the sitting up nice and tall. We try to do this practice, breathing in and out through the nose. Obviously, if you've got any breathing conditions or illness, or like a cold or anything like that, and you have to breathe through your mouth, that's fine. But ideally, do this in and out, breathing in and out through the nose. So giving 1 or both hands on the belly, as feels comfortable for you. We're going to start by breathing in and out for a count of 4. Then we'll move to a count of 5, and then just at the end to a count of 6. 6 is the optimal, the best way you can be doing this, 5 total breaths per minute. But work with, it takes a bit of practice, so just work with how it feels for you and find a rate that feels comfortable. And I will just count. So beginning by breathing in, 2, 3, 4, breathing out, 2, 3, 4, breathing in, 2, 3, 4, breathing out, 2, 3, 4. Keep that rhythm going, 2, 3, 4, out, 2, 3, 4. And you can count this in your own head at the same time. 3, 4, out, 2, 3, 4. So start to extend the inhale now. So you're breathing in, 2, 3, 4, 5, out, 2, 3, 4, 5. And just that's it, smooth breath in through the nose. 3, 4, 5. Smooth breath out through the nose. 2, 3, 4, 5. And if 5 feels too long, just go back to 4. And just let the breath return to normal, your own natural rhythm. Maybe notice, perhaps you feel a little bit more energized. Maybe you've breathed right down into your belly, which we don't always do. But hopefully that's giving you a little insight into just a simple technique that you can use just to really promote just a healthy way of breathing. So thank you so much for your time today. Enjoy the rest of your meeting. So, and yeah, contact, and if you need to have any more information or would like my details, just contact the Healthwatch Croydon team. So thank you. Namaste.
So thank you very much for organising that, Robin, and that was really, really good. I certainly feel revitalised and ready for the second half of the meeting, so I hope everybody else does as well. We actually have some individual reflections on what it was like to work through the first stages of the pandemic from some individual people now in this section of the meeting. I'm hoping that Marion Spence, who's a ward sister at Croydon University Hospital, is with us and able to talk for a few minutes on what her experience has been. Ah, here she comes. All right.
Hi.
Marion, thank you.
Right. So just in regards to the experiences, I'm going to really touch more on the human factor of what was happening on our ward. Working on a trauma orthopedic ward that became overwhelmed by default with COVID-19 patients. As a team, we had to quickly adjust to a new presidential phenomenon that was swept not only the nation, but Croydon University Hospital. It was hit with one of the largest cases of COVID-19 patients, but when it hit our ward, it felt quite polarized, meaning everything felt amplified. The fact was, for some, they were not able to rationalize their feelings and had to create a forum for staff to vent and express themselves. I had to remember that we were not only just nurses, that we also were human, and the fear was now the common denominator. I was constantly having to troubleshoot on all elements of nursing care for the patients and even provide pastoral care for the staff. So that it became the challenge daily for me. Therefore, all the nursing attributes became more sharpened, and having to lend yourself in areas where you wouldn't before. There was a lot of information that was being cascaded from top to bottom that I had to communicate to the staff. The frustration was when the information kept changing in line with the evidence that was provided by the government, and there was some muddling in the way we were delivering the information. So the integrity of that information became a worry to the staff. So we had to start rebuilding that trust back with them. We streamlined most of our policies based on the information given by our comms team and through our chief, nurse Elaine Clancy, who had daily gold updates, and policies were changed through that. The chief executive, Matthew Kerschel, that he constantly was coming down onto the wards and ensuring that his presence was evident, and there was an embodiment of good leadership. Their mantra, which resonates with us all now, is together we can get through this. A can-do ethos. Do you know what I forgot to do? Okay. Yeah, so it was a can-do ethos. We required a remarkable amount of strength and flexibility as we were having to deal with a limited workforce due to staff going off sick or having to quarantine for 14 days. The manpower was at a lower ebb at that time. The routine of care was once semi-predictable, but became extremely unpredictable, and the patients came with a plethora of issues, albeit psychological, physical. spiritual or social. And guess what? We also had the same, health issues, psychological, physical, spiritual, and social. So it was a matter of having to deal with that, as well as conduct professionally our work. The first encounter of problem solving was where some of the staff refused to work, and this was by no means due to lack of PPE, as we had plenty. It was fortunate for this hospital that we were had a good supply of PPEs. It was because they were dealing with the unknown and a virus that had no regard. The fear for some of us was the overwhelming aspects of the fear took over our reasoning, and at times displayed an irrational and bizarre behavior. And I may smile at this point because when I think of some of my colleagues that were doubling up on masks and wearing the PPE inappropriate, at this point I could smile. At the time it was quite frustrating because we had to then roll out the learning and the rationale as to why you are safe in wearing the PPE in the proper way. But again, when fear comes, all reasoning is thrown out of the window. So the necessity for infection control to help reassure and support them, they came onto the ward daily, and they also were visible and also were retraining the way we think, the way we done our doffing and donning. So the elements what we had to deal with each day became catastrophically immense. I was truly firefighting, having to ensure that the ward had the appropriate PPEs, and again we were in line with the government guidelines. The staff at that point were feeling overwhelmed, and the nature of the work became unpredictable. They felt insecure, helpless and unsure. So the turnaround was, what did we do differently? We done a lot of upskilling to respiratory nursing, because remember we were coming from a trauma orthopedic. Our nurses adapted very well. CRT, community respiratory team were involved, especially when the patients were being discharged. COVID-19 is a very isolating disease, and you can just imagine the patients having limited contact with their families, and the actual digital services that we gave was iPad and Zoom. So we've done a lot of our communications via that, and that was helpful. That was therapeutic for some of the patients, because there were no visiting time. So all those policies had changed. So it was just a matter of having to adapt very quickly. There was a lot of planning, and the way we executed a safe and effective delivery of care, ensuring the main goals were met. Saving our patients' life was the main goals, and reducing risk of exposure for both patients and ourselves. So we had to really be equipped with the way we done our PPEs, as I said, the donning and doffing. Hand washing was essential. Nursing care was bundled to limit the time spent with patients in the bay. We huddled in the morning, not just for patient handover, but gathered for emotional uplifting. We reflected upon work that we could do better. We bonded and we strengthened our camaraderie. We adopted a better working relationship. So when I think about us as a whole, when I reflect back, it surely propelled what I now say a superhero in me, a strength that I did not realize I had. My whole team became Avengers of COVID-19. And funny that I liken it to superheroes, but that's what we were, and that is what we had by default become. So it was unreal. Personally, I'm sure with many others thought that they were it was either going to be the make or break of them in their career, but we had to compartmentalize our emotions in order to get through the day. So it taught us to be resilient. It taught us tenacity, and it definitely gave a different outlook on what we were. We were brave. So that's my input.
That's wonderful, Marion. Thank you very much. I think it's been really helpful for people to hear how it was at Croydon University Hospital in the early days of the pandemic. So thank you very much. And it looks like you're working today. So
yeah,
we're going to go back to work. Okay.
Thank you.
Wonderful. Thank you very much. Thank you. Thanks. Bye-bye then.
Bye-bye.
Thank you. So quite a hard act to follow, but I'd now like to introduce Dr. Rachel Tombridge, who's a GP at East Croydon Medical Centre, who is going to tell us a little bit about how it was for her and her colleagues. Dr. Tombridge.
Good afternoon, everyone. Thank you for inviting me to speak today on my experiences during the COVID pandemic. As you've heard, I'm Dr. Rachel Tombridge. I've worked as a GP here in Croydon for 9 years. I trained in Croydon for the 3 years prior to that. One thing I can say with absolute certainty is that 6 years of medical school, 5 years of junior doctor training, and 9 years of working in general practice certainly could not have prepared me for what's happened this year. So, the start of 2020, GPs were alerted to the outbreak of a new respiratory virus originating in Wuhan, China. We were sent memos, guidelines to ask about travel history in patients with a cough and a fever, and the number for Public Health England was pinned up on the wall in our consulting rooms. This all felt vaguely familiar. We had similar experiences with new respiratory viruses in the past. Most recently, there was one known as MERS, and we followed a similar process for a short period of time. However, as the days and weeks went on, there was a growing sense of unease that this was different. Within a matter of weeks, general practice, as I knew it, had changed almost beyond recognition. Suddenly, the waiting room, empty. My appointment screen, which would have been filled with a list of what we would call face-to-face appointments, was replaced with a list of telephone calls. We knew we had to do this to protect our patients and our staff, but it was a significant challenge, and certainly not the general practice as we and our patients knew it. The general practice consultation is really so much more than a simple exchange of information. Even with our newly adopted video consultations, it did not feel the same for me. The subtle changes in body language and eye contact that can reveal so much, the confidences a patient might impart when they feel comfortable and heard in a safe space with their doctor. We are aware that this cannot be easily replaced using technology, and also recognise that in certain circumstances, these remote ways of consulting may not be suitable for some of our patients. The face-to-face consultations took place wearing PPE, a new experience for most of us. It's been no secret that obtaining appropriate PPE was problematic at first, and we are very grateful to the kind volunteers who worked incredibly hard to make scrubs, face masks, visors and the like to support us. As Marion said, we were also making sure we were keeping up with the stream of new information and guidelines we had to read, digest and follow, and in some cases actually develop ourselves. The situation was changing on a daily and sometimes hourly basis. Patients look to us for certainty and reassurance, and we will always do our best to help them through what was an anxious and uncertain time for everybody. We do care and worry about our patients. As doctors, we are certainly not immune to feeling the same worry that the entire nation was feeling. So we worry for our patients, obviously, about COVID, but we also worry about the other consequences of the pandemic on their health and well-being. As a GP, I see the whole patient, and often we know these patients over a lifetime. We always work to do our best for them, both for their physical and mental health needs, and even more so during this unprecedented time. I look after patients in 3 large care homes, and I couldn't do this talk without referring to the impact of the pandemic on our care home residents and colleagues. COVID has certainly shone a spotlight on our care homes over this time. They too had issues with obtaining appropriate PPE and keeping up with rapidly changing and evolving guidance. And as GPs, we had to change how we worked with our care home colleagues and establish remote ward rounds. We worked closely with our community teams, including our rapid response team, to support the homes during this time. And most homes also had the support of a 24/7 telemedicine service to support them. So what else did we do in general practice? We adapted. and quickly. We embraced technology to use video consultations to see patients. We texted patients a lot. Paper prescriptions, a thing of the past. GP staff were working remotely from home. We used our skill mix in general practice to reach out to vulnerable patients to make sure they were getting the support they needed both medically and socially. Practice paramedics supported home visiting. Our community rapid response team supported us to manage patients in their place of residence and avoid admission if appropriate. Our practice meetings, including multidisciplinary meetings, continued virtually. We found ways to continue childhood vaccinations in a safe way and to safely see those patients who needed to be seen. We soon became experts at the donning and doffing, new words for me, I have to admit, and we started to wear scrubs. As GPs, we worked with all our system colleagues in a way we had not done before. One example is we established a weekly Croydon GP network call where we were able to discuss issues with our clinical colleagues. In summary, we have learnt an awful lot from the last 7 months, and we continue to be here for our patients. So yes, the doors to the surgeries may be closed, but we are most definitely open and prepared, and we will continue to be so as we head towards winter and whatever that may entail. Thank you very much for listening.
Thank you very much. That's been really helpful. I know that we often hear from patients about how it's different getting in touch with your GP these days, but it's really useful to hear how it is from your side. So thank you for that. Thanks. Okay. Thanks. I'd now like to move on to look at how people in the community and the voluntary sector experience the COVID pandemic. And we've got Rowena Davis from Croydon Mutual Aid to talk to us. And here she is. So I'll hand over to Rowena. Thank you.
Thank you so much, Edwina. And can I just also say, Marion and Rachel, really moving contributions. I'm sure I'm speaking for everyone on the call when we're just so full of admiration for your work. And Marion, that story about you all huddling in the morning, looking after each other as well as patients, it's really touching. As said, my name's Rowena. I'm a secondary school teacher, normally in Croydon, and a local resident here. But when the crisis hit, I, like so many people, went online looking for a way to help. And together with some other colleagues, set up Croydon COVID-19 Mutual Aid. For those of you who don't know, it's just started as a Facebook group online, and it very quickly got to 4,000 members. It still exists today. And it's also underneath that Facebook group, 70 WhatsApp groups operating at a local street level, where local neighbours, maybe in those WhatsApp groups of maybe 20 to 50, are helping each other and helping local neighbours with like basic day-to-day tasks, things like food shopping or prescriptions for those who are self-isolating, dog walking, or just a basic friendly chat. And this was so important because what we helped to do was to take the pressure off of those more like acute frontline services that if they'd been asked to help with the basic shop would have just been totally overwhelmed. I think one of the things, or one of the stories I wanted to share with you about that was of a woman we helped who was experiencing domestic violence. This one really touched my heart. A lady got in touch and said she'd managed to get a new flat with her children after her partner was abusive, but she had no furniture for any of them at all. They were living in an empty flat. And we put out a note on our Facebook group and on our WhatsApp groups. And within like 4 hours, she had a fridge freezer, a sofa, 3 beds. Like she had everything that she needed, and it was all delivered by volunteers, all completely for free. And she was moved that this happened, and just the power of that community so quickly to help was really, really important. In terms of what we had to do differently and quickly, this was all new to all of us. Obviously, you're operating in this environment where the need for help is high, but the ability to help and the risks of helping are also really high, right? So we had to quite quickly come up with some safeguarding guidelines for our volunteers. Obviously, sometimes volunteers really want to help by going into someone's house, especially if someone can't carry shopping. But you can't risk spreading that virus. Procedures about hand washing and sanitizing and all of that, we'd had to quickly come up with those guidelines. And we also had to figure out very quickly how to work with the existing partner organizations that were already there. So working with Sarah Burns, CVA, on the call, who's been amazing, and the local food banks and Age UK, we organised almost like a tiered traffic system, so kind of low risk people who need a bit of help would come into us, and then we'd refer up as age and vulnerability went up, and we all worked together to kind of triage who went where in the most efficient way. So that was really, really important. And we managed to do that even by setting up a formal helpline for all members of the community that still exists. And still to this day, if you need some help, you can call the helpline and we'll either come and help you ourselves, or we'll refer you to an agency that has the specialist training and expertise in order to do that. I think in terms of what I've learned, just to conclude, I've always known that Croydon was a very special community, but the power and level of support and help and love and time and effort that people have put into looking after each other here has been absolutely phenomenal. We were able to do it much faster than the council. Obviously, the council have to set up procedures, they have to go through training and safety checks, they're dealing with more vulnerable people, but we were able to get out food parcels really, really quickly to those people in need, especially in those early weeks. And the power of neighbours has been phenomenal. And I really just would love us to kind of keep working together, keep having organisational meetings like this so that we stay in touch and we don't just do this in emergency times, but this is just how we live together and how we look after each other.
Thank you, Rowena. That's really inspiring. Thank you for explaining to us what happened. And I think you're right. It would be really good to be able to harness all the goodwill and all the volunteering effort for the future, really, rather than losing it as hopefully the pandemic subsides at some point. I'd now like to introduce Richard Eyre, who's the last of our individual speakers. He's the Head of Innovation and Change with Croydon Council, and he's going to talk about the pandemic from the perspective of the council's role in supporting vulnerable people. Richard, there you are, lovely, thank you.
Hi everyone. So yes, I am Head of Innovation and Change in adult social care, and wasn't really prepared for just how much shielding and COVID was going to impact my role over the last sort of 9-10 months. I'd like to say I previously worked for Healthwatch Sussex as their operational lead, so I really understand the great work of Healthwatch, and thank you for having me here today. So let's go back to February. We started, as everyone said, understanding that this virus was much bigger than anyone was expecting, and government guidance started flowing out and changing on a daily basis, as I'm sure you're all aware. And what we had to do was set up a shielding team, and effectively that was calling out to people who were registering on the government website that they did were in fact going to shield. So just to give you some of the numbers, in Croydon there are 15,000 people who we were expecting to needing to do some form of shielding, of which just over 8,000 people eventually registered. And the government's guidance was very clear: every single one of those people needed to be contacted. So we pulled together the shielding team and started making our calls. We pulled in staff from libraries, parking, Gateway, the contact centre, myself, my team, even at one stage the mayor's mace bearer was making phone calls. Going back to those 8,000 people, by the time we'd made all the calls, what was pleasing to know was only 859 actually required support in the end. But I suspect very much the work of the voluntary and community sector and the mutual aid groups was the reason why that number was much lower than maybe we had anticipated. Some of the added data you might like to know is that the council actually delivered about just over 2,000 food boxes, of which just under 1,400 of those were for people who were shielding. But again, this was backed up by over 2,000 food box deliveries from the voluntary and community sector that we're aware of. So when we were doing the shielding service, again, as we spoke to people, what became aware was needing information about food, medicine, but also isolation. I remember having a very lengthy chat with one gentleman because simply that person was lonely and had been shielding for a couple of weeks and just wanted to chat to someone. What we started to learn at that point was very much some of the crucial referrals we were making were not just about emergency food, which the council was providing, or to the voluntary community sector for sort of ongoing support around food, but it was actually the work around self-isolation. So the companion line that AGK and Croydon Voluntary Action set up became a crucial place to refer into. In terms of contacting residents, as I say, we made calls, we sent letters, we even used text messaging, and we even had members of staff going out and making door knocks to people who the government and we couldn't have contacted. And again, we learned a lot about sort of things there. You know, we even had to contact the GPs to see if people had contacted their GP and just weren't answering our calls because we were a local authority and there were trust issues there. So it really was making sure that we left no stone unturned in contacting people. We also tracked the government food boxes to make sure that those food boxes were being received. And I think the other thing to note here as well around all of this, a lot of those people who are shielding were also known to the council, and in social care and safeguarding, where home visits were needed, those social workers and colleagues did make the home visits and did use the PPE. So we got to close down and there were about 2,500 people receiving government food boxes. We called all of them again. 100 of those needed referring on for additional further support immediately. And just under 300 said, look, if shielding does start again, we will need a weekly food box. So those people are on our list, and I'm sure you're all aware at the moment, it feels like shielding could come back anytime soon. So we're preparing for that. So that's part of the planning. And I think just to go into some of the things that we're learning and we learned at the time, social isolation is a big part of shielding, and it's something that really, you know, everybody has a role in terms of whether you're just a neighbour to someone or an organisation and how you're referring on them. If you're just calling people, do you need food box? It's about that additional questions, you know, is there anything else you need? Do you need sort of referring? Do you know that these organisations are out there? I did hear one lovely story. There was a lady and sort of she'd gotten the call and she was so happy. She was like, nope, don't need anything. These two young girls in my road came and knocked on my door and they're going out and they're getting me things every week and I'll be fine. And I know that people who were in the call handling team regularly heard those sorts of stories. And I think it goes back to the mutual aid point, which is just this unseen army of people just getting on with it and going out and making sure everyone was okay. So hopefully that gives you a bit of a reflection of how sort of the council went about sort of in the height of shielding, supporting residents, certainly in an emergency sense and from those who are well known to us, but also making best use of our colleagues in the voluntary community sector as well. Thank you.
Okay, thank you very much, Richard. That's really helpful, giving us a sense of what actually happened around people who were shielded. I think there was a lot of information in the press about shielding, but very little factual information about what it actually meant. So that's been really helpful. Thank you. Thanks. Okay, so now we're moving on to a section where we will be inviting a panel to join us. A panel of people working at senior level in health and with the council. I'm hoping they're going to appear on the screen in a moment so that I can introduce them. Yes, I can see Matthew Kerschel, who's waving. Oh, there they are, and there's Rachel, Sony and Dr. Agnello Fernandez. I was going to attempt to introduce people, but I think it's probably better if they introduce themselves, because I'm bound to get their job titles wrong apart from anything else. So perhaps if I could start with Matthew first, if you wouldn't mind unmuting yourself and explaining what your role is, please.
Thank you, Edwina. Hello to everybody who's on this important AGM. My name is Matthew Kerschel, and I am Chief Executive at Croydon Health Services and place-based leader for health here in Croydon, working across the trust, but also the CCG, and bringing those entities together to try to plan and deliver the best healthcare we can to the population here in Croydon.
That's really helpful, thank you. And perhaps if Rachel, if you could introduce yourself next, please.
Good afternoon, everyone. I'm Rachel Sony. I'm Director of Integration and Innovation for the Council. Also, working to bring together our health and care services across Croydon, and working in the Adult Social Care and Health Wellbeing and Adults Department in the Council.
Thank you, thanks. And last but not least, Dr. Agnella Fernandez, would you like to introduce yourself, please?
Thank you, Edwina. Agnella Fernandez, I'm a GP. I've been a GP in Croydon for the last 30 years, and I'm the chair of the local Croydon committee, which is a subcommittee of South West London CCG.
Okay, thank you very much. Thank you. So we asked our participants at the beginning if they could post any questions that they might have onto our Q&A section. I'm just looking here to see if there are any questions for yourselves. There was one that seems to have disappeared that I was going to ask, but never mind. Never mind. It was about people, whether people would be frightened to access their GP service or come to A&E at the hospital, given the fear of contracting the coronavirus. And given it's such an important issue, I wonder if panellists might be willing to say something about that, whether people should be frightened, if there are any precautions they ought to take if they think they need to visit A&E or go to actually see their GP at the practice. Dr. Arnella, would you mind speaking first? Would that be okay?
Yeah, so we've heard from the speakers earlier on in terms of experiences of staff, and that was kind of mirrored in terms of concern and worry by patients as well. I think the key message to say to people is that the NHS is open for business, and if they have got a worry or health concern, they should contact their GP in the normal way, either on the telephone or electronically, and they'll be able to speak to a GP in terms of directing them to whatever care they need. Rachel mentioned alternative ways of consulting online, on the telephone or video consulting, but GPs have been seeing people right through the pandemic face to face, either in the surgery or at home, and for palliative care, and for people who are housebound right through the pandemic using PPE. So I think in terms of being able to access a GP, that's certainly available now and has been throughout the pandemic. People shouldn't be scared of doing that. In fact, we encourage them, if they have got a concern, to do that, because during the pandemic, people didn't want to bother the NHS and really built up problems related to potential cancer or heart disease or heart attacks, which they didn't really contact anyone. So it's important that they do that now. But what to expect when they are invited to come to the surgery is to follow the guidance, wearing a face covering, using the gel at every door, following the social distancing rules, and also anticipating they're not going to see the GPs wearing normal clothes, like in the hospital they're all wearing scrubs, which was new to us, as Rachel mentioned, and also having the social distancing when you're seeing a doctor or nurse, unless you're going to be examined. So certainly people that are unwell should contact their GP. Those that are coming in for immunizations and routine checkups, and we're seeing a lot of those now. They stayed away before, but now it's important to say that GP practices are seeing everybody, in terms of the routine work, as well as the ones that were related to COVID. And so people shouldn't feel they shouldn't feel that they can't contact their GP. The ability to do that is there in different ways, and it's safe for the staff, it's safe for the patients to do so following their guidance.
Okay, that's really helpful, thank you. Before I ask Matthew if you could answer that question, please, I'd just like to welcome Sarah Burns to join us on the panel. I'm really sorry, the problems with the IT means that I couldn't see you, but you're there now, I can see you and know that you're here. So Sarah, would you mind unmuting yourself and just explaining to people what your job title is, what your role is? Thank you.
Yes, thanks a lot. It's Sarah Burns. I'm Head of Communities for Croydon Voluntary Action, and we coordinated the voluntary and community sector response to COVID-19 and are working hard at bringing the voluntary sector or continuing in partnership as we go forward, responding.
Lovely. Okay, so thank you very much. Thank you. Sorry about that, Matthew. Would you mind explaining about people coming to A&E? Do they just turn up, or what should they do if they're fearful of catching COVID?
Okay, I mean, the first thing I think I would endorse entirely what Agnello said is that we're taking very careful precautions at the hospital as we are in the community, and as I know primary care is, to make sure that the patients are safe and indeed our staff are safe as well, and that means use of appropriate PPE and hand washing and social distancing. So that's the first thing. So I wouldn't want people to be concerned, because our job is to provide our services safely, and that's what we're working hard to do. So I again endorse what Agnello said to that end. You ask a question specifically about patients arriving at A&E. We have just started in Croydon a pilot called 111 First. There'll be some more communications coming out about this over the coming days. And this is a pilot scheme initially where we are for sort of non-urgent. So obviously, if you're a very urgent case and you need an ambulance, then you'll be coming directly to A&E, and rightly so. But if you're a non-urgent case or a less serious but emergency case, and you would have usually attended A&E, we're running a pilot whereby we're encouraging people to phone 111 first. That's the national number that people can use. They get through to a trained clinical professional, and that person can help to assess and then direct the patient to the right place. That might be to a pharmacist, it might be to a triage list on a GP practice, it might be to a slot in an urgent care centre or a GP hub here in Croydon. So it's about, for patients where it's appropriate, booking a slot for urgent care. Now, I know some people will say, how do you book a slot in a service which is usually just go and wait in a queue? It's because we're now trying to improve the experience for people and also limit the amount of time that they necessarily need to spend in waiting rooms where clearly if there's lots of other people, there's a potential, even though we work hard to mitigate it, there's the potential for infection spread. So the booking of a patient into an urgent care slot is something that we're now testing. It's been live for a few weeks, and the feedback we've had from patients has been really good. In fact, I got a text message from somebody this lunchtime saying that they've got a colleague who had used 111, they broke their foot, they got booked into a slot through the 111 First programme. They came and they said it was a fantastic experience. So we're trying different things to try to further reassure, Edwina, people about how we can manage and reduce the risk of people potentially being in large groups waiting to come through emergency department. But in addition to that, we'll keep following the guidelines about hand washing and face mask wearing and social distancing. So those two elements is how I would describe it back to colleagues, and more information about that 111 First is coming out in the next few days.
Okay, so thank you very much. That's really helpful. I've just been looking at the questions, and we have one here that I'd like to address to Rachel and to Sarah, if you don't mind. But if Matthew or Agnello have anything they'd like to add at the end, that would be fine. So I'll read it out because it's quite a long question. We have heard a great deal about innovation during the sessions today as a result of running health and social care during COVID. Will we be able to hang on to those innovations, and what benefits will they bring to the people of Croydon? So Rachel, is there anything you could say to that?
Yeah, we have particularly the partnership working side of things, and the pace of which we've been able to bring solutions to the fore, I think, is probably one of two of the main things that we're really trying to hold on to. We have documented quite a bit of the learning that we've taken during COVID right across the system, whether that be about the pace of mobilising and supporting the voluntary sector alongside our statutory response, and how we can maintain that in terms of the pace of being able to do away with some of the usual bureaucracy and decision making that's required to make things happen. Particularly Richard was just talking about shielding and how quickly we were able to bring in a response to people who otherwise could have been quite vulnerable and at risk. So there's quite a lot documented about what we can do. I think particularly what Matthew's talking about there, our digital response to things, calling first, making contact, trying to make every contact count, and dealing with things at first inquiry. So there's quite a lot there about using our technology wisely, trying to do things in a digital way if we can. And quite a lot of support can be done in a multidisciplinary way across agencies, or in a virtual way, actually. We don't always have to see people face to face. But what I would say about the previous question, particularly for adult social care or vulnerable people, is, we are encouraging people to phone first, but we absolutely will go and see people where we need to see people face to face, and we take all the necessary precautions around COVID that we need to. So yeah, there's an awful lot that we're taking learning from in terms of our speed of response, digital response, and ability to work in partnership. I think they're probably the top three things.
That's really helpful. Thank you very much. Thank you. Sarah, from the point of view of the voluntary sector, do you get a sense of how the voluntary and community sector are responding to the need to work differently, and whether that's likely to continue in the future?
Yeah, I think firstly, tapping into the strengths of the community in terms of the people, the creation, what matters to people, what they're passionate about, what they value, is where we should start in the first place. It's if we can start with the strengths rather than unfortunately, institutionally, we tend to look at needs, and that sends us down a cul-de-sac into providing services for people. And people want to be a part of their own solution. They want to have value themselves. They want to give their community, what they have to offer. So we've seen some brilliant demonstrations of that during this crisis. And I think, mutual aid, Rowena, that spoke earlier, I think that showed very quickly how people do want to be part of finding the solutions. They want to be able to help their neighbours. They want to feel good about actually being able to support one another, and that's beneficial to their own health. And it's beneficial to all of us, because there's no service that could do what mutual aid has done. And I think there's been lots of brilliant demonstrations across the voluntary sector of innovation. There always is. That's what the voluntary sector in many respects does best. It fills those gaps. And I think the more we can do to enable that creativity and recognise it, our statutory partners have been really good in Croydon at recognising that strength, and the more our leaders can do to welcome that strength and to ultimately allow for sustainability there, because some of these initial things, it's not always about the funding. Sometimes it's about the networks and the shared resource and the pooling together and the common values, and a lot can be done with that. However, of course, there's only so much that can be done, and you know, sustainability is an issue for much of the voluntary sector. But you know, we have a wealth in Croydon, and we've got a lot to be proud of in terms of our people and our sector, and we've overcome in crisis again and again. So you know, I'm hopeful that the things that will come out of the learning of the crisis are things about recognition of the strengths of our people, empowering people to be part of that solution, and a desire to work more collectively together, statutory and voluntary, members of the public, to pull together, you know, for what we all want to work towards, better health outcomes for everybody.
Okay, that's really helpful. Thank you. Thanks. Is there anything that Matthew or Agnello would like to add?
Just very briefly, Edwina, I'm sure Agnello will want to talk about a whole host of primary care developments, but just one that I would flag from the hospital perspective is the Croydon Elective Centre. So that's we've created a setup whereby we've separated out planned surgery to allow us to continue to treat those patients even as we start to see an increase in the number of COVID patients, because we've separated it out. And that took quite a bit of redesign, reorganisation of people's commitments, the redevelopment of flows across the hospital, and the establishment of a whole setup within that space. And we think that over time will prove to be extremely positive in terms of us protecting elective space, reducing that horrible situation where patients are having to phone to check if there's a planned care bed available for them on the morning of a procedure. We've now got it working, and my hope and indeed plan is to continue that post-COVID. So there's a good bit of learning that we've done during COVID that we would definitely carry on post. It will have challenges to do that, of course, because of the ever increasing emergency pressures, but that's absolutely our hope, because we think it's a better way of working for our patients, their families, and indeed our staff. So there's one example, Edwina, that we'd like to, if we can, continue post-COVID.
Okay, thank you very much. Thanks. Agnello, is there anything you'd like to add? And can I just say, we've had somebody commenting, asking if you're hiding in an Egyptian tomb today.
No, I think I tried to reply on there, but it's saved, so I don't know if we can get it out of that. No, it's just using different backgrounds to keep my sanity, being on so many calls. I'm not in the surgery today, so I'm not in scrubs, but we wear one set of scrubs, but we'll also wear apron and gloves, which we change between patients, and also a gown if we know that we're over that, if we're examining a COVID positive patient, either in the surgery or at home, in their homes. So I think Matthew's point about saying, you know, we're doing both the routine work as well as the acute pathway is an important one, and most surgeries will have ways of trying to ensure that there are clean paths to the surgery, that they're seeing patients for routine work, and also how they're going to see people that are acutely ill that may have suspected COVID. So it's about trying to protect the staff as much as the patients, and trying to avoid having the social distancing in waiting rooms. So not having waiting rooms that are crowded is really critical, so that patients coming in for cold procedures are not always mixing with people that have unlikely COVID symptoms. The importance of talking to somebody before they come is really critical to ensure that they haven't got symptoms that might be COVID. Also in terms of what alternative care they may need or advice. But I think what kind of changed overnight, which was difficult to change because it required behavioural change of GPs and practices, was working remotely. So working on the telephone, but more importantly in terms of video consulting. And actually the vast majority of people have appreciated video consulting, being able to take photographs and send them through. See, it's not for everybody, and there is an age dimension to this, but certainly the younger people and the middle-aged people are really taken with the video consulting. But even in the older age groups, in the initial phase, we saw a lot of ceilings were doing video consulting, but people soon learnt in terms of where we needed them to point the camera, and actually were quite glad when they successfully made their cameras work. So I think it's a learning curve for some people, but others it's duck to water. The other is the online consulting, and so more patients find that they may on a 24/7 basis want to ask a question, and they can do that on different practice softwares now, including 111 online. But the big change is that trying to keep everybody safe, being more accessible, is really the critical change, and going back to not having the options of face-to-face consultations, telephones, video. I think the spread of availability of different ways of consulting will carry on, because that meets the needs of different groups of people, and also in terms of time, because a lot of people waste time booking an appointment with a GP, taking time out of work to come to a GP, and actually if they've got a telephone or video consultation, it saves them a lot of time as well in their day. So there are positives that we're realizing, but also aware that there'll be different age groups that you need to see face to face, and also people that you need to see at home. And I think home visiting has always been a challenge, because especially if you're seeing somebody that is likely to be discharged with COVID, or somebody who you think has got COVID, in terms of the additional PPE you'll be wearing, and making sure that you've got disposable covers to your car seats as well, and that you make sure that you take every precaution in terms of not taking the virus back with you, and changing into a different set of PPE when you come out. So all these different precautions are all new, but they're likely to be with us for a while. So I think in terms of getting used to it for the staff, but also in terms of the patients, there are difficulties. If you've got somebody that you're seeing that is hard of hearing, and you've got a mask on, it's very difficult for them to lip read as well. So these are all issues that we need to take into consideration, and wearing a visor, for example, might be helpful when you're dealing with people with hard of hearing. So there are all sorts of new ways of working that we've discovered, which is tailoring to the individual patient and the individual consultation. So I think a lot of these will remain and have been a positive development.
Okay, so thank you very much. That's really helpful. I've been checking the questions that have come in whilst people have been speaking, and there's a quick question that I'm hoping Matthew might be willing to give an answer to. People are worrying about what they've been reading in the press and on the television about the increase in the number of people with coronavirus at the moment, and the impact on the hospitals in the northwest of the country. And just wondering if COH is coping, or if there's an increase in inpatient admissions of people with coronavirus, if it's affecting ICU or ventilation beds at all.
So thanks, Edwina. I'm very happy to update. So we are seeing a slight increase, but it's from a very low base, and it's also compared to what we saw in the first wave, relatively speaking, very low number still. So we at this moment have 10 patients in the hospital who have coronavirus diagnoses. None of those are in intensive care. We have had somebody in intensive care in the recent days, but they've recovered well enough to be discharged from intensive care, which is fantastic. And that's one of the things that I would reassure the public about is obviously coronavirus is can be a very, very serious condition, and there's still no vaccine, so no sort of prevention. But what we have done in Croydon, as with all other healthcare systems across the country, and I mean by that systems, not just hospitals, but community services and primary care too, we've learned much more about how to manage patients with COVID than we knew the first time round, and therefore we're able to inform how we manage those patients this time from that experience, and that will help. So at the moment the numbers are relatively low, and we hope that continues for the next period. If it doesn't and things start increasing significantly, as it has done in the Northwest, then we're prepared and ready and able to respond to that, and that's part of our job to ensure that we are, again, right across the system, primary care, community services, and here in the acute part of the healthcare in Croydon. We're ready, we will be able to respond. We will try to maintain those elective services I talked about, the planned care, rather than cancel that summarily like we did last time. So we're ready. The numbers are relatively low at the moment. They will increase because that's what's the nature of the pandemic. But hopefully, if everybody helps out in the community by following the national guidance about social distancing and hand washing and mask wearing, that will help to minimise spread, and that will help to reduce the number of people who have to have healthcare, whether that be in primary, community or the hospital, and that would be a good thing for everybody. But should we need to, we can upscale, we are ready, and we will respond in the way we did first time round.
Thank you. I'm sure people are very reassured to hear that. Thanks, Matthew. To change the subject slightly, we've had a question about care homes, and about how partners are working with care homes, specifically around the use of technology. Now, I know that there has been a development around telemedicine, telehealth, but also the use of iPads or smartphones or whatever to help residents keep in touch with their relatives and so on. Is anybody able to talk about how we're getting on with the care homes, and if there have been any issues relating to working with technology in particular?
Edwina, can I bring Rachel Tombridge if she's still there? Are you still there, Rachel?
I'm still here.
Yeah. Did you want to take that question, Rachel?
Yes, of course, no problem. So yes, technology in the care homes has been another rapid development, something we weren't necessarily using before, but in Croydon we had a slight advantage in that we have a telemedicine service in approximately 80 of our care homes. So that's where the care homes can get support from a healthcare professional 24/7. So we were using technology already. And that service was very well utilised during COVID, which is great, and they helped us on a lot of different things. From a general practice perspective, it's initially a lot of us were actually using our own phones because we had to do this quickly, and the technology wasn't necessarily in place, but we managed. The care homes got they either their own sort of care home phones or iPads. We had ours. We did our video ward rounds. But gradually most of the homes are now getting iPads as well, which they're using for Skype calls with loved ones when the visiting is difficult. I think, as we all know, that has a lot of positive benefits, but is also sometimes not the preferred way of communicating, but needs must. And we also have other technologies such as telehealth, very confusing terminology. Telemedicine is where you use the laptop to connect with the health professional. Our telehealth service is where equipment gets put onto a patient, so you can check blood pressure, oxygen, and it all feeds back to our rapid response team. So that patient can be monitored in their own home or care home, and that could potentially avoid an unnecessary hospital admission, which obviously has clear benefits for the resident and for the system. So there's a lot of technology. It's a work in progress, and I think the care homes have adapted fabulously because it's not something they were necessarily used to using, and it's been really positive. And again, as we've been saying, I think this is something that will continue. And it's all about the balance of the technology and the face-to-face, and just getting that, striking the right balance there, so we can treat people right place, right time, and the right person.
That's really helpful. Thank you very much, Rachel. Thank you. And thanks, Agnello, for that. I wonder if Rachel Sony has anything she wants to add from the point of view of the council.
I think really I was going to say mostly what Rachel said. We know there's been a substantial increase in the take-up of the telemedicine during the COVID period. And just really the amount of work, and I don't know what was already said pre us coming onto panel about the amount of work done with our care homes, but a significant amount of work on the care home system response plan. We've had over £3 million of funding go into our care homes to support with infection control, plus another 750,000 for one-off payments to help with provider sustainability. So we've had over 1,000 people trained in our care homes on infection control. So we really do have quite a detailed plan of work and partnership working across clinicians, the council, our commissioning department and our care home providers. So I've got more detail on that if people want to know more about care homes and the work that we're doing to protect all our residents living there and the staff that work there.
Okay, thank you very much. Thanks. So if anybody wants to know more about that, can they contact you directly or yeah, that's fine. That's lovely. Thank you very much. Thank you. We're coming towards the end of the meeting now, but there are still some more questions. I was wondering if the panel wouldn't mind if I squeeze in one extra question before we finish. Louise Cretton has asked a question about any advice that you could give people to help them to look after their physical, emotional and spiritual health during this difficult time. And I wonder if we could start from the community sector, Sarah, first, if that's all right. Sorry to put you on the spot.
Not at all. I think that one of the best things that people can do is to connect with others, particularly anybody that they can find that's a positive inspiration. So my advice would be to try and reach out and connect with people, to be able to check on one another and to support each other. Thanks.
Okay, thank you very much. That's really helpful. Anyone else want to say anything about that?
Yeah, Edwina, something to say that, you know, we're fortunate in Croydon of having social prescribing link workers as well, and practices in the community can help people be connected to their local communities. And as Sarah said, it's really important not to be isolated, but also to ensure that you get some exercise, whether it's in the garden or just outside as well, and being able to talk to people, because there's lots of social isolation as well, which causes problems on its own. But you know, if they don't know what to do, they can contact their GP surgery, who can put them in touch with the social prescribing link worker, who can connect them up to local communities. And the local community hubs as well are now available, and if they don't know about that, they can be connected to those as well. So that we're fortunate that we've got a good network of voluntary sector which they can be connected on, and if they only know their GP to contact, then they can do that and be connected.
Thank you, thanks. Rachel or Matthew?
Just talking to each other, and you know, using the wealth of services that we do have, and not only services but just connections and interventions that we have. We have our Croydon advice line if people need advice, to look that up and take advice. We have a new companion service that's run between CVA and AGK Croydon if people know of people that are lonely. And we do have befriending services and places that can put you in contact that would then lead to other things, as well as the mental health support and additional mental health support that we have. People, you know, I would just encourage people to ask and talk to each other.
Thank you, thanks. And Matthew, is there anything you want to add before we finish?
Well, I think keep connected, as others have said. Don't feel like you're alone in this. There's lots of resources and opportunities out there for people to get support and help. So that's the first and most important thing. The second is to know that to have confidence that the health and care service is here for you. You know, that's our job, but also our passion, and we're very keen to ensure that we do the absolute best by people, and therefore hopefully that will reassure people. But I would concur with my panel colleagues that talking and connecting is really, really important at this time, and do find a way of doing that.
Okay, lovely. Thank you very much. Well, thank you very much to all of our panel for answering those questions, particularly since you'd had no clue what the questions were going to be and they were just thrown at you. So I think you did incredibly well. We have got a couple more questions that we haven't had time to ask. So what we'd like to do, if you don't mind, is email them to you. And if you have anything that you'd like to say that you'd be willing for us to put on the website, then we can answer them in that way. So it looks like everybody's happy to do that. Thank you very much for your time, everybody. And you're welcome to stay to the end, but I know you've all got busy jobs. So thank you. Thank you very much. Thanks. Bye-bye then. Thank you. Okay, so we're almost at the end, but we want to have another go at the poll that we tried earlier. We've got a couple more polls that I'm hoping we can put on the screen one at a time so that people can have a go at voting. Are we able to put, there we go. So this particular poll says, what area would you like Healthwatch Croydon to focus on next? These are just broad areas to give us a sense of what you feel the priorities are. So if you wouldn't mind choosing one from the list of GPs, which is, you know, local primary care doctors, social care, community services, which we include voluntary services and community health services in that, quite a wide area, dentistry and hospitals. So if people wouldn't mind choosing one of those and clicking on submit at the bottom, then your results will go back to the master poll or whatever it is that we'll see in a few seconds time that shows us what people are choosing. It would be really helpful if people can vote, because that helps our local leadership board to look at what we should be focusing on next in the next pieces of work that we do. I'm hoping that people have had a chance to choose what they would like. I'll just give the choices again: GPs, social care, community services, dentistry and hospitals. So if people could submit their choice, and then we'll have a look and see what the outcome is. I'm hoping that means the outcome's coming up. There we go. So dentistry, which is interesting. Michael was talking about his experience with dentistry recently. Okay, thank you very much. That's really helpful. So we'll certainly consider that in the work that we're doing. We have a piece of work on dentistry just starting, so that will help to inform that. And then we've got one more poll, if you wouldn't mind, if we can put that up on the screen, please. Here it is. So again, I'll read it out. What changes due to COVID has made a difference to you? So differences in the experience of the following due to COVID. Digital GP appointments. You can click as many as you want on this one. Digital GP appointments, new ways of delivering face-to-face appointments, services being delivered at neighbourhood level, support while shielding, support from voluntary and community services, for example, mutual aid, digital hospital appointments, or none of the above. So if you can choose from them, just go down the list and click on as many as apply to you, and then click submit at the bottom. We can have a look and see what the results are. As people are probably aware, and as our panelists have said today, the local health services, as with national health services, are looking at trying to embed some of the rapid changes that they had to make during the pandemic into the long-term ways of delivering services. And so the information here will help people to know what local people are thinking about some of the changes. So have everybody had a chance to choose what they want or what's made a difference? And let's see what the result is. So new ways of delivering face-to-face appointments, that's interesting, particularly given what people have been saying on the panel. And what others? Digital GP appointments, digital hospital appointments, and then support and local services. So clearly there's an issue about digital. And one of the questions actually to our panel that we didn't have time to address was about whether there's going to be any sort of training available to help people locally to become more comfortable with digital options. And it will be interesting to get the answers to that. So thank you very much, everybody, for that. I'd just like to thank everybody who's participated in our meeting today. It's been quite a challenge for us because this is the first big meeting that we've hosted. Particular thanks to Gordon and the team and to our board members. I was hoping they'd all appear on the screen while I'm talking, but I can only see 6 at a time and only one person's cropped up. Where are we? Let's have a look. There we go. We've got some of them showing anyway. So thank you very much to everybody who's been involved in both organising the event today and in participating in it. And particular thanks to Karen Bateman for that armchair yoga at our break, which I thought was really useful. We want to receive feedback from people on how they've experienced this meeting, both in terms of the way in which we've needed to organise it, given the COVID restrictions at the moment, but also the content, of course. There is going to be a survey that you can reply to. I'm not quite sure how you get hold of the survey, but I think it comes up at the end of this. Gordon, can you nod if that's right? Yeah, okay. So, sorry, there was a fly there. So thank you very much to everybody. I won't keep you any longer, but if you could please fill in the feedback survey and send it back to us, that would be great. So thank you very much, everybody. And we'll also put the unanswered questions on our website as soon as we can. And if you need to know any more about Healthwatch Croydon, just look on our website and you'll see what you need to see. And if you'd like to volunteer to work with us, then just let us know. That would be wonderful. Okay, thank you very much, everybody. Thanks. Okay, bye-bye then.